Hello, my name is Clara Barton, founder of the American Red Cross. If you're watching this video, that means that you volunteered to serve as a medical professional in the Union Army. Congratulations! First, let's make sure you understand some important things about the Army Medical Department. At the start of the war, we only had one Surgeon General and about 30 surgeons. Supplies were very low. We lacked proper medical instruments and necessary items, as well as eager volunteers. As a nation, we anticipated several casualties and knew that in the heat of this bloody war, we were in dire need of proper care for our wounded soldiers. Luckily, the United States Sanitary Commission was developed, allowing us to have an influx of supplies. Even so, we run short very quickly, so it's important to economize. Also in New York, the Women's Central Association for Relief was formed by Elizabeth Blackwell, the first female doctor in these United States. She encouraged women across the country to volunteer. Soon, we had over 2,000 new recruits, and you are one of them. You've made a wise decision. By using what you'll learn today in this video, you'll soon be able to treat our soldiers and save lives. Let's get started. As a nurse, you will encounter many instances of both illness and injury. It's important to be prepared for anything. Many times, you will encounter patients with serious wounds. One of the most common is a bullet wound.
Ah! Yeah, my leg! Help me! Clara! Clara, I got shot! Help me!
In this situation, it is important to first make sure that the scene is safe. Once you've completed that task, now it's time to try to move the bloody patient onto the bed. You're gonna be alright, Steve. Alright, come on. Alright, let's do it.
I can't get up.
Come on, Steve. Good job. At this point, try to use a sharp object or even your bare hands to get the bullet out. Something a baby, Steve. At this point, take some mildly clean rags to try to stop the bleeding. It's gonna put a little bit of pressure on you, okay, Steve? Continue to do so until the bleeding stops. Use a bandage to really seal that wound in. Well, at this point, it's safe to just leave your patient and go treat somebody else.
What?
When you return, almost slipped there. Make sure that the wound hasn't developed any kind of infection. And if it has, get ready to amputate immediately.
What? No, Clara, you can't do this to me.
That's alright, Steve, because before we do, we're going to distribute an anesthetic.
What?
The Army Medical Department recommends the use of chloroform as much as you see fit.
Please, you can't do
And good night, Steve. At this point, it's safe to call in the surgeon and amputate immediately. You will also encounter many instances of illness here at the camp. Probably because we have a really horrible food supply, but that's besides the point. Here comes one now. First, make sure that the scene is safe. Next, examine the patient's symptoms. Does he seem cold, tired, agitated, homesick? It could be because he's at war, or it could be smallpox. So it's important to get him to the infirmary. It's also probably good to give your patient some food and drink to comfort them a little bit. Here you go, George. Next, try to get your patient a little bit more comfortable. And at this point, we're gonna just hope for the best. Finally, it's important that you understand the basics of cleanliness here at the camp. Every time you treat a patient before you move on to the next, it's important to rinse your hands in some water. Now, we don't exactly have a lot of it, so you may have to use the same bucket for every week or so. Then, dry your hands thoroughly and dispose of the towel in the dirty towel pile properly. Congratulations! You now know everything you need to know in order to be a nurse. Now remember, you will encounter many instances of death here at the camp. However, don't listen to those people who tell you it's your fault, that you gave them too much chloroform, or that you roughhoused too much. Please, you're a trained professional, and you've come a long way in these past couple of minutes. And now, you're ready to go out into war. Good luck to you, and God bless America.